We do a quick announcement, and then we'll get to questions. We discussed at some length on Friday. It continues to be the view of this administration that stopping this Ebola outbreak in its tracks in West Africa is critically important to our national security and to the safety and health of American citizens. Again, as Dr. Fauci said yesterday on some, it might have even been on your network, the likelihood of a widespread outbreak in this country of Ebola is exceedingly low. But the only way that we can entirely eliminate that risk is to stop this Ebola outbreak in its tracks in West Africa. And in order to succeed in stopping this outbreak in West Africa, we're going to need doctors and nurses traveling to West Africa to treat Ebola patients. By working with CDC, the state of New Jersey has determined that it's appropriate to. But ultimately, it's the responsibility. In fact, the authority is vested with state and local officials to make decisions about how best to protect their citizens. Three new executive actions. What we believe is important, and I think this is a view that is shared by governors and local officials across the country, is that these kinds of policies should be driven by science and the best scientific advice that is available. As I mentioned before, I wouldn't rule out some sort of public appearance from the Department of Defense policy has not been settled and implemented yet, and they will ultimately, that will be a decision that's driven by a variety of operational factors. What this administration is working to do is to coordinate with state and local officials across the country to put in place the policies that scientific experts tell us are in the best interest of the American people. And I don't think we do that by making our living in a tent for 2 or 3 days.
So the White House disagrees with